Back to lockdowns. As we mentioned, the verdict is in. They made a minor difference in saving lives. Bringing a friend of the show, Dr. Amesh Adalja, who studies infectious disease at Johns Hopkins. The study, Doc, came from Hopkins. What do you make of it, and how conclusive is it?
I think it kind of backs up what many of us have thought for some time, that these blunt tools like lockdowns, because of the way they were instituted and because of what they included, what they didn't include, because of people's compliance, because of people doing things that were kind of more risky but underground, for example, gathering indoors at someone's house and eating outdoors, we're not going to be that effective, that these blunt tools just aren't what we want to be reaching for. And if you are reaching for them, that tells you that many policies have failed before you even get to such a blanket type of order.
Yeah, stay-at-home order only saved 2.9% of lives, school closure 4.4%. I mean, we were told that this was going to save millions upon millions of people. Do you think that the powers that be have learned from this?
It's unclear, because what we see, for example, in places like Europe is that they run back to lockdowns. Or when we heard about the Omicron variant, travel bans got put in place universally, even though we knew they wouldn't work. I think politicians want a quick and easy solution, and that's what they're going to reach for. But what we need to really instill in people is that it should be targeted, precision-guided, voluntary guidance to people so that they can learn how to navigate risks, to know what's more risky, what's less risky. Because, for example, if you're telling people they can't go to a park, it makes no sense based on transmission. And at the same time, you're not actually taking the effort you need to do to stop mortality by, for example, fortifying nursing homes. Instead, many governors did the opposite with nursing homes.
Yeah, you're specifically New York and Andrew Cuomo. I wanted you to help put in perspective the study in these statistics. States with strict lockdowns versus states with loose lockdowns. This is total deaths per 100,000 people. New York, 0.88, Michigan, 1.03, Florida, 0.84, South Carolina, 0.71. In both of those cases, COVID deaths per 100,000 over the entire time, the non-lockdown states did far better. Is that what we're seeing in this data?
I do think that states that were less stringent with their lockdown policies did a lot better than most people predicted. And I think we have to go back and examine why that is. Is it because those tended to be warmer states where more things could be done outdoors? Or is it because people voluntarily did what the lockdowns couldn't achieve? If you look at cell phone mobility data, you can see when COVID was bad in a certain area, people voluntarily, ahead of any governor's order, started to decrease their movements and limit their circles of interaction. So some of the data on decreasing mortality might actually be from people's voluntary actions rather than a governor saying, this is what you must do. So there's a lot of work that needs to be done to actually analyze where states fell on that map. But clearly Florida and Texas, for example, did a lot better than other states. And I think that's something that needs to be explained.
Yeah, I want to get back, and I don't know if you were able to hear all of the open, and if so, we appreciate you being here early for the live shot, especially with kids in the background. I'm wondering about if we're going to hear from any of the scientists, the government folks who did these lockdowns, that they were wrong, or maybe they didn't work, and be willing to go back and do the postmortem. And if so, great. If not, how dangerous is it for science if you don't learn from your mistakes?
I think it is important for people to go back and look at the decision-making and what drove those decisions. And we already know that the WHO has said that lockdowns are evidence of a policy failure. But what I think happened is in places like New York City, where they were really worried about the hospitals being able to survive, they had to do something in order to kind of pull a circuit breaker so that those hospitals didn't get crushed. But what happened is many governors across the country just extrapolated what was going on in New York City and then had an indefinite type of lockdown, which wasn't driven by metrics, and it didn't necessarily work, and it didn't actually do the things they needed to do, which was work on nursing homes, get testing stood up, get people the ability to understand which activities are more risky and less risky. All of that is something that I think we have to go back and revisit. And many of the policymakers were kind of going off of infectious disease experts telling them what will decrease cases. And it's up to those policymakers to be able to weigh all of that and say, what are the long-term consequences of this? Is this sustainable? What are the negative cascading impacts we're going to see with schooling, with other medical care, with people's mental health and substance abuse? And that's something where all of our governors basically abdicated. They didn't know what to do. They didn't think long term. They just panicked. And I think that's what we have to really get over, because there's going to be another infectious disease emergency. And we have to get our policymakers up to speed to take this seriously and take the correct action, not just take any action.
You have, from the very beginning of this, been a sober and serious voice, and to your credit, have said things earlier and said I was wrong then and come back. And that's why we keep having you back, and we're glad you come. Thank you, Doc. Good to see you.
Thanks.
Yeah. Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.